everyone, my name is Madeline and I'm going to be doing an informational video on spinal fusion and my experience with scoliosis. This is for the people who are very scared like I was before I got surgery and are looking up YouTube videos left and right. So I hope this video helps you, and if you have any more questions you can just comment down below and I'll try to answer them, or if I don't answer them you can always DM me on Instagram and I would be happy to help. What is spinal fusion? It's when they join two or more vertebrae together and it prevents movement between the fused vertebrae. So why did I get spinal fusion? It's because I had scoliosis. So what is scoliosis? It's the curvature of the spine. It could be an S or a C shape. Personally for me, I had an S-shaped spine. I had a very big growth spurt within a year, so that's, I'm pretty sure, how I got my scoliosis, but it's kind of like unsolved how people get it. It could be a genetic thing or growth spurt or something else, but who knows. So my thoracic, which was the top part of my spine, was 55, which is the recommended degree to get surgery, and then my lumbar, which is the bottom portion of my spine, I'm pretty sure it was like in the 30s or 40s. I don't remember the exact number, but it was pretty severe for me to at least get surgery. So when and how did I find out I had scoliosis? I was 14 years old. I am pretty sure that is the exact age. And I was picking something up and my mom saw my back and she was concerned because it looked off, and it was off because I had scoliosis, which I'm pretty sure, like I said, was from a growth spurt, because I did gain a couple of inches or an inch or so, and I also gained weight. So I'm pretty sure that is what happened. For everyone it's different, but personally for me I think it was a growth spurt. We didn't really try to fix it until like a year after because we didn't think it was that big of a deal, but it was a big deal because look at me now, I got surgery. So if you are suspecting that you have scoliosis, I do recommend going to a doctor as soon as you possibly can, because messing with the spine is not a joke. It's like basically the core of your bone structure, so I do recommend getting that fixed. So did I try anything to fix it before I got surgery? And yes, I did. I'm pretty sure the first thing we tried, we as in my mom and I, was the brace, and I had a Boston brace. It was awful. I will insert a photo of what it looked like. They put holes in it to ventilate it, but I live in Arizona, so it was really difficult. It did not ventilate it at all. It was still hot, sweaty, and itchy. There's a lot of different ways of bracing, like, because a Boston brace is like hard plastic with like a styrofoam-ish like inside. And then my friend Maddie, she had like a strap method, which I don't know how much that helped because you had to adjust like how tight it was and you could mess it up. Like I don't know the whole thing behind that, but there's a lot of different ways you can do bracing. Personally, I did not like it. I was a freshman in high school trying to fit in, so having a hard brace on me was very difficult and I hated it a lot. So we did a lot of research, and I did Schroth therapy, which is a form of physical therapy that I think is like originated in Germany. It's like a really rare therapy that you have to find someone who's certified wherever you live that does it. It might be more of a common thing now, but it was really expensive and I wasn't super consistent and motivated to do it. So I mean, I did get surgery, so that explains that. If you are motivated and you want to be consistent, then I totally recommend it. Maddie, she is very consistent. I'm pretty sure she's done pretty well with physical therapy, so everyone's different, but to each its own. So now I'm going to be getting into the surgery portion of the video. I'm going to be talking about how I felt personally before I got surgery, because it is very nerve-wracking and I'm pretty sure a lot of people get nervous. I'm not sure if everyone has anxiety, but honestly, in this day and age, I feel like everyone does. But my anxiety is very severe, and the thought of hospitals, being in a hospital, blood, shots, anything, scares me. So I was nervous. It was about 2 months before when I found out I was going to get it. So I was just trying to finish junior year happily as I could. It was very difficult because like a week after school ended, I had to get surgery, and everyone was like looking forward to their summer, and I'm over here like, yeah, I have to recover from a very extensive surgery. So, yeah, I mean, it's a lot mentally to go through. I mean, I promise you it will end well if you do have the right doctor, which is the next question I'm going to get into. But yeah, I do recommend it. It is very scary, the whole process. I think the pre-surgery is probably the scariest than the post-surgery, because overthinking is deadly and it's awful and I hate it. So the next question is, how did I find my doctor? And luckily my mom did all of the research, booked all of the appointments, and did the best she could. I'm very grateful for her, and I'm also grateful for my parents for helping me with this surgery, because if they didn't, I'd probably end up being in a wheelchair by like 50 years old and collapsed lungs and whatever the heck else could happen, like who knows. We went to about 5 different doctors, maybe even more. It was a very stressful experience for my mom. Luckily, I didn't have to do any of that work. I do feel bad. It took a long time to like figure it out, and I'm sure if you're a parent watching this, you probably have struggled with this or will be struggling with it, because you want the best for your kid, and I totally understand that. So I mean, it's good to take your time to find a good doctor than rush into it and just go with the first one you see. So I do recommend doing your research. So when did I get surgery? I got surgery in 2017, right before my senior year. Luckily, I was able to go to school right when senior year started. I'm very grateful for that, because I didn't really want to miss any of that, and I don't want to have a lot of absences because that's not fun. So now I'm going to get more into the surgery part of the video, like the preparations and the things you should buy before. For me, I used a wedge pillow like the whole time. I slept on the couch a majority of the time. That was most comfortable for me. Everyone's different, but I'm just speaking on my behalf. Also, a lot of people talk about like a shower chair, which I used, and then also the toilet seat that like it's a toilet seat but it's like raised up, so you don't have to like sit down as far, you know what I mean. I personally did not use it because I didn't like it and it was weird. I felt like an old lady the whole time. It's not a very fun feeling as a 17-year-old. And I also had a walker too, so you can imagine how I felt. But it did help me a lot. I do recommend these things. I shouldn't be complaining. But the walker I used to use around my apartment complex when I had to get my blood flown, because they recommend to walk like every night or so. And I live in Arizona, so it was really hot, and it was during the summer, so I just did it at night. I tried my best. My mom would walk with me, and I appreciate that a lot. So before the surgery, I don't know if every surgeon is the same, but for me, they had me like use these sanitary wipes to wipe myself down before I went to sleep, and then right before my surgery. I am pretty sure about that. They want you to be as clean as possible, obviously, because you don't want anything getting inside you, bacteria. Ugh. Also, I know that there was like the whole you can't eat and drink before. I don't know how many hours it was. I wish I could give you a number, and I wish I remembered that. And then what to bring for your surgery day. I don't really remember everything I brought. I'm pretty sure we brought too much stuff, because I really don't remember using that many things. But obviously I was not mentally here on planet Earth. I was on morphine, which is interesting, and I will talk about that later. I'm just, bringing things up beforehand. But I brought chapstick. That's the one thing I remember, because my lips got super chapped. They do recommend you bringing that, just because I actually don't know the science behind it. Like, I literally do not know. But just bring it. That's all I can say. I also brought, like, stuffed animals. I know, like, I'm, like, old, but, like, I think a lot of people still have stuffed animals. And it's nice to have, especially when you're super loopy and you have, like, some comfort, because hospitals aren't comforting at all. And then I also had an iPad I played on a lot. I think I used my phone a lot. I really don't remember. I try to like do Snapchat, and I might insert some photos and videos of me being stupid.
Hi guys, I have a lot of medicine in me. Fun. Other than that, I don't have anxiety because I have so much medicine in me. I'm really tired.
I also brought like my clothes for when I got discharged from the hospital, which I'll talk about later. So the day of the surgery, I don't really remember much. I know I was like kind of happy in the beginning, like in the car driving to the hospital. I don't know why. Probably just because I knew I was going to get it over with, which is the most relieving thing ever. But I was extremely nervous, like right before, of course. And all I remember is being with both of my parents and being in the waiting room and then going to the room where they put you under. And then I remember the doctors being extremely nice because it was a children's hospital. So that was fun. Like, I enjoyed that because if I had mean doctors, I'd have a whole different experience. And then when I got put under, I don't really remember the whole process with that, but all I remember is being wheeled and seeing really bright lights and knocking out. And I think I was pretty loopy, saying some weird stuff, so I honestly don't know. My mom might remember. I kind of want to ask her because I really forget what happened, but you know, that's all I can tell you. I'm going from my experience here, so that's all I remember. And then right after the surgery, the same day, it took about like maybe 3 to 4 hours, which is fast. I think sometimes it takes up to 7 to 8 hours depending on who it is, doctors, whatever. I was extremely loopy. I did not understand that I got my surgery over with. I might insert a video of me being loopy. I'm not going to put the whole thing in there because it's very embarrassing.
Is it weird to think that your surgery's already done?
It is.
Yes.
Yeah, you were done like an hour or two.
Your
Hour
back is
ago.
already.
It's already
you're-
healing. But
Now it's in the healing process.
Like, you know, the wisdom teeth videos, it's like that, but worse. Because I was like on that surgery medicine. I don't know what it was, but it was very strong.
back too.
I
You
know.
did a really
he
good
did.
job.
He did a really good job.
Like you're gonna be.
Are you sure about that?
They said that you might be 4 inches taller.
What?
Maybe. We
No,
don't
not
know.
that tall.
She said that they can be that much
Oh.
taller, depending on how the curve is. You might be more like 2 though, because your curve. Well, your curve was pretty bad, but
Not as bad.
not
as
too
some
bad.
Kids.
So you might be 2 to 4 inches taller.
But you're so.
Who's crying?
Also, they do put like a tube down your throat, so your throat does hurt a little bit. And then they put like stuff on your eyes, and then it gets all crusty afterwards. Like, obviously they take that out, the throat thing out afterwards, but you still like kind of feel it. And you're just hooked up to a lot of different stuff, which is a little bit uncomfortable. In the hospital, I was there for about like 5 days. I was very loopy. I was very talkative with all the nurses. I would wake up easily. I'd wake my parents up. I'd have full-on conversations at like 3 a.m., not understanding what time it was. Like, I had no, like, I couldn't grasp the time and what was going on. Like, I was just really happy because I was on morphine. And every 30 minutes, they'd let you, like, press the button, because obviously you can't keep pressing it. But you would want to press it because sometimes it does hurt really bad, and it's not very fun, but once you get the morphine, then you feel fine. And then I also had a bunch of visitors. I know I do remember some of the people that came, and I do remember some experiences, but there are some people that came that I don't remember coming, and I'm so sorry. I was very out of it the whole time, so I'm sure it was very entertaining. I don't really remember, but yeah. And then the food there, I could only eat mac and cheese, applesauce, and chew ice, and I loved it. I still kind of miss the mac and cheese. It was really good, not gonna lie. But yeah, that is all I ate, and it's really weird to think because that's kind of gross, but. And I think the day 2 or 3, they made me walk, like do their physical therapy thing, when I had to get up. and I wasn't able to just like get up. Like I had to roll to my side and like push myself up. It's difficult, but you get used to it, and now I can just get up like a normal person, but at the time I couldn't. I felt really crippled and old. It was really weird. But when I got up, I was 6 foot. Now I'm 5'10", and I think that I'm very grateful for the surgery, or else I wouldn't have started modeling, I feel like, because I was 5'7", 5'8" at the time before my surgery, and I also have a very straight back too, which is pretty so. But yeah, once I got up for the first time, I was 6 foot, because my back wasn't like used to being upwards. But eventually, of course, it settled down, and I'm shorter now. But it was crazy. I was taller than my parents, and it was really weird. And then the discharge day from the hospital, all I remember is my mom helping me put clothes on, because I couldn't do it myself. I was in pain. I looked like I got ran over by a truck, because I had long hair at the time, and my hair was all knotted and gross, and it was weird. I don't really remember much, but I remember I got wheeled out. My aunt came to help, and they drove me in her van back to my house, and I don't remember that at all. I don't remember coming inside the house. I don't remember sitting down, but I just remember the whole like part of the recovery. It was not fun coming home at all, because I didn't have that button. I had to take all my medication. I had to take it liquid form, because I couldn't really take pills at the time, and I still have difficulty, but it's like a gag thing. Like, I don't really like it at all, even though liquid medication is like absolutely disgusting. I know that, it's gross. But they gave me like Oxy, Valium, and then something else to help like you poop, because you can't really poop after surgery. It takes a while, and it makes you feel gross, I know. But my mom luckily took a whole month off of work to help me, and it was hard for her, it was hard for me. It was hard for me to eat too, because I'd get nauseous, but eventually I was able to start to eat more stuff. I was the laziest person ever. Like, obviously I barely could get up. My summer was not fun compared to other people's summers, but you know, it is what it is. My mom had to help me shower. I had a shower chair. It was very uncomfortable. It wasn't fun. But I mean, nothing about the surgery is like fun until like you're fully recovered. But I'm very grateful my mom did that for me, because it's really weird having your mom shower you, but I wasn't able to do it by myself. And we also bought one of those shower heads that is like retractable, so once I was able to start showering myself, because it was hard to move my arms, I was able to do that, which helped a lot. So during the end of the recovery, I had to like be off of Oxy, because obviously I didn't really need it anymore, and I could have started taking like ibuprofen just to dose it down a little bit. And it was really difficult. Obviously I was not addicted, but my body wanted it, so I got a really bad fever, and I got super sick once I stopped taking it. You just get really sick, and it was very uncomfortable, and I hated it a lot. But luckily I did it, and I was fine. It lasted maybe about like 2 or 3 days, like this weird fever I had. But I was maybe able to go out and do whatever I wanted within like a month and a half after surgery. I tried to go out. It was hot, but I'd get really lightheaded here and there, and I would have to sit down, so I couldn't be up for a long time. But at the end of that summer, before I went back to school, and my summers were like maybe like 2.5 months, I'm pretty sure, right? I went to California with my dad, so clearly I was like fine, but for older people it does take a longer time to do that. So I do recommend, if you are young, to get your surgery now. But that is the end of my video. I hope I post this, because I've been meaning to post this for a very long time, and I hope I help people. And if I didn't answer your question, please comment down below, and I hope I help. And thank you for watching, and this is very informational, and yes. Thank you guys for watching, and if you want to follow me on Instagram, you should do that. If you want to subscribe, because hopefully I'll be posting vlogs on here. I just needed to get this video out of the way, because I've been meaning to do this for a long time. But Yeah, I don't know how to end videos or do anything with YouTube, so thank you.